the ectopic pregnancy in the OSCE. This patient, if you do get this in API, comes into the assessment station as a patient that's got pregnant through IVF over many rounds, and now they've lost the pregnancy. They've had an ectopic pregnancy and they have to have the operation to remove the fallopian tube. So not only is it very sad, but it's also quite an emergency to have an ectopic pregnancy. So you need to be thinking of several factors here. For one, to support the patient with their emotional distress, and they can be very upset. They can be almost inconsolable. But also think about the safety aspects of somebody bleeding and ask them those questions. How much have you bled? And be thinking about their OBS and how relevant that is when you take the patient's OBS and do the A to E assessment. So really that patient is very similar to the surgical patient with the abdo surgery, as in they're nil by mouth and they are being prepared for theatre, but they have the added complications that they're very emotionally distressed and that they may be seriously unwell, because an ectopic pregnancy can be a surgical emergency. They always use the scenario that the patient is in the same sex relationship. So they've been through rounds of IVF to get pregnant and now they're losing this pregnancy. They just need to see you show compassion to this patient throughout this station.